Good afternoon and welcome to the third floor conference room of the Waco City Hall, where we regularly have now, for the 16th week actually, conducted these press conferences to better inform you about what's going on in our community with COVID-19. Joining me again today is Mayor Kyle Deaver and Dr. Jackson Griggs from the Family Health Center. We're not able to have Judge Felton on today. He had a prior commitment, and so we'll miss his being part of it, but we'll still be doing a lot of answers to questions, and we will have media online as well. We're providing American Sign Language translation for our video of this as well from our studio downstairs, and we're also recording a full Spanish translation of everything that's being said that will air on a total replay of this video, but with the Spanish translation this afternoon at 4:30 on our channel. And here again to graciously introduce and invite our Spanish-speaking audience to that is our City Council representative for District 2, Hector Sabito, who's also going to make a little comment or two that is really appropriate because Hector is also the co-chair of the Strategic Communication Committee Collaborative that the mayor appointed back at the beginning of this whole COVID-19, and he's done a marvelous job of working with various forms of communication throughout our community, and he has a special message because we're dealing with a disproportionate number of persons in our population in the Hispanic area, and getting communication to those is very critical. And so, Councilman Sabito, if you'll do your introduction and give us your message.
Thank you so much, Larry. I do want to invite all the people that are going to be that are want the conference in Spanish that they'll be invited later on to attend. Pero para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido de inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa por internet en wccc.tv o en el canal 10 de la ciudad de Waco. Thank you, Larry. And I also want to thank Mayor Deaver for the opportunity to speak a little bit this afternoon about the impact that COVID-19 is having on the Hispanic community here in McLennan County in the city of Waco. I just wanted to share some information that we have gathered over the weeks that we've been experiencing this. There have been over 2,044 cases as of 3 p.m. yesterday, and 63 of those cases that are in our county are Hispanic related. And especially impacting the ages between 20 to 49. So 59% of those cases are between those age groups, so the majority of them. Especially with the Hispanic households, we see that there is a huge impact on the zip codes that are 76706, 76707, and 76708, which a lot of the zip codes are predominantly Hispanic, or at least half of the zip codes that the people that are living in those zip codes are Hispanic. Out of the cases, there have been a total, as of 3 p.m. yesterday, there's additional one, but 13 deaths. 50% of those deaths have been Hispanic as well. So you can see half of the deaths that we've experienced in our county have been Hispanic. There have been 380 recoveries as of 3 p.m. yesterday, but out of those recoveries, only 21% have been Hispanic. So as you can tell, it is impacting our Hispanic community the most, as we see right now in McLennan County. There are 3 explanations that we give for this. Number one, it is that a lot of blue collars and frontline workers that you will see are Hispanic. So the workers that you see in restaurants, the workers that you see in lawn care, the workers that you see doing laundry, you will see the Hispanics. So they are exposed to it more. Secondly, you have multi-generational families that are living under a single household. So in the Hispanic culture, it's very common for not only parents and children to live in there, but sometimes grandma and aunt and uncle live in the same household. And so when you put them in close proximity like that, and one is infected, then the family is likely, very likely to do that. And then number 3, there's a lot of fear of receiving medical attention, because there might be some people that are dealing with the immigration status or have no insurance. And so our message is please take care of yourselves. If you can stay at home, please do so. I know at the summertime there's gatherings, there's family gatherings in the Hispanic culture. Family is very important, but we're asking, even if there is a wedding or even just going to your mom's house or your sister's house or your brother's house, even though you might think they are safe, you never know that they might be carrying the virus, and it might not be impacting them, but it could impact you or your spouse or your children in a completely different way. And so we're asking to please stay at home, only go out to do the essential things. If you need to go to the grocery store, please only one person from the household. Please do not take your children or the entire family. Try to do the best to just take one person. And just a reminder to keep wearing your mask while out in public. Please practice physical distancing of at least 6 feet, and please practice washing your hands thoroughly, even if you're touching objects from the grocery store, your mail, etc. While you're at work. If there is no hand or soap disposal, please carry hand sanitizer. That'll work as well. But we just want everyone to be as cautious and be careful because we know that we are being impacted tremendously, and we want to see the virus stop, not only in the Hispanic community, but in the county and the state overall. So thank you so much for the opportunity.
Thank you, Councilman Sabito. Thank you. We'll follow the same procedure we've done in the past, and we'll ask for opening remarks from Dr. Griggs first, and then followed by the mayor. Dr. Griggs?
Thank you, Larry, and thank you, Mayor Deaver. I have cases to report, and then I have a few comments that may take a few more minutes than I usually take to describe some of the psychological factors at work in our community. So let me first start with case updates. So worldwide, we're at 11.9 million cases and 545,000 deaths. The pandemic has been going on now for more than 6 months, and the global incidence, that's the rate of new cases, continues to be on the rise and to accelerate. The United States has more than 3 million cases and over now 130,000 deaths. The current daily incidence in the United States climbed through the month of June, now at 51,000 new cases each day in the United States. In Texas, the Department of State Health Services indicates that we have 210,000 cases in Texas. That's up from 160,000 reported last week, so 210,000 cases. Coronavirus hospitalizations across the state have more than doubled in the past 2 weeks, and we've had 2,715 deaths in our state. Per the Johns Hopkins Coronavirus Resource Center, our state 7-day moving average positivity rate in Texas is 14.4%. So now updates for the county, and this is as of this afternoon. The total number of confirmed cases is 2,283, 1,941 of which are currently active. As of this afternoon, the Public Health District has received notification of 239 new cases of coronavirus. At the cutoff time for reporting this morning, and what you'll see on covidwaco.com is 42 people hospitalized with COVID-19, 6 of those hospitalized patients needing ventilator support. We received an update just a little bit ago from the hospitals indicating 44 people hospitalized, and 11 of those patients hospitalized are on ventilator support. And both hospitals have ample capacity to manage new COVID-19 cases for the immediate future. We have now had a total of 14 deaths due to COVID-19 in the county. As of a couple days ago, total lab tests performed in McLennan County, 27,944, with total resulted tests for residents of McLennan County, 23,068. So the number of the 27,944 are all the tests that have been performed. 23,068 are the tests that have been performed on McLennan County residents. Approximately 800 people detained at the jail in the Jack Harwell Detention Center have been tested. Actually, I'm sorry, 1,100 people detained have had tests performed for coronavirus. 300 of those are back. 800 are still pending. 300 of those 300 test results that we have back, 19 are positive. And then finally, the effective reproductive rate, that RT that I've described before, this is per Children's Hospital of Philadelphia. Their policy lab that is tracking McLennan County indicates that our effective reproductive rate has come down a little bit from 4 to 2, which is certainly in the right direction, and maybe largely due to some of the changes in behavior and the wearing of masks. So the global pandemic has surfaced some really beautiful acts of kindness and self-sacrifice, and some relatively remarkable animosities and divisions that may feel curious to some of us. I was asked recently to speak to some of those psychological factors that might be going on in our society and why people seem to be coming to some very different conclusions about the novel coronavirus and COVID-19. And so maybe what I have to share will help us understand each other a little bit better and allow us to offer each other ample grace during this period. One of the key emotional responses that we feel in crisis is fear. Virtually none of us are spared, even the toughest, most stoic one among us. An infectious pandemic and the resulting social and economic disruption has created a crisis of uncertainty for all of us. All of us have been affected, and I think all of us have experienced and felt some degree of negative emotion from this. Research is pretty clear that when fear is coupled with a way out, it can be deeply motivating. Several years ago, I was hunting, and I was at a hunting cabin with a group, and there was a hidden gas leak, filled up the house with gas. Somebody struck a match to light the stove, and the whole place ignited in flames. And I didn't need a motivational seminar or anybody to coach me to get out the door. I was plenty motivated. But when there's a sense that our behavior doesn't make a difference, when there is no door out, and we sense that we're trapped, we don't feel motivation. Instead, we generally take one of two paths. The first path is depression and hopelessness. There's no way out, so we sort of give up. And on the other hand, many people who experience fear coupled with powerlessness have a defense reaction, especially among those who are uncomfortable with vulnerability. Fear can lead to a paradox called optimism bias. People demonstrating optimism bias deal with their deep and often unconscious fear by minimizing that anything bad is going to happen to them or their loved ones, even while bad things happen to others, even when the compelling evidence suggests that they are at risk. Most people would agree that solid health behavior decisions depend on accurate information about cost and benefits. With clear thinking, good information, we can all judge what we're willing to give up for the sake of something that matters more to us. If our perceptions are distorted, though, because we've not allowed ourselves to really explore those deep emotions, it can be really hard for us to see clear enough to make decisions that are congruent with our values. In other words, it can be hard to see things as they are and make decisions accordingly, particularly when they trigger strong negative, deep-seated emotions in us. So while I think optimism bias is a really important thing that we should understand is going on, I'll just mention one other dynamic that's at play. And this is more of a kind of a cultural phenomenon. A key element of any culture or people group is how individuals consider themselves in relation to others. Here in the United States, we tend to think of ourselves as independent rather than interdependent. In general, we have a strong commitment to individualism and less of a sense that we are really dependent on the collective. And obviously, there are great strengths to this kind of thinking. And at the same time, during an infectious pandemic, when contagious spread has us all hooked and entangled together, failing to recognize our interrelatedness and the biases that can accompany our cultural mindset of independence can lead to dangerous outcomes for those that we all really want to protect. I haven't actually been wearing glasses for very long, but I already forget that I'm looking through a lens. And I point out our cultural orientation just so that we can all remind ourselves that we are looking at the world through our particular lens. So in summary, recognizing that we may tend towards a risky optimism bias when we feel powerless, and that as a people group, we tend to think of ourselves as independent rather than interdependent. With these two factors in mind, perhaps we can understand where each other is coming from a little bit better and offer each other lots of patience and grace in this challenging moment.
Mayor Deaver?
Dr. Griggs, thank you for those words. And I think that we do need to think about that, and that certainly impacts the way people embrace or don't embrace wearing a mask, because it is to help others, not ourselves. And so it's that interdependence that we are struggling with right now, and I think that's a key message. I want to go ahead and get into the graphs for a minute, and then I've got a couple of other things to say at the end. But we are continue to be in a really bad situation here in Waco. It has gotten worse since last week. I showed last week where we were the week before. Now I want you, as I move through these slides, look at the scale on the left. We were at about 455 total cases, confirmed cases last week, or 2 weeks ago, I'm sorry. As of last week, we were close to 1,000. As of today, we're over 2,000. This number is growing exponentially, and it is a very dangerous situation in our county, in our community. This is hospitalizations. Our hospitals are currently, the latest count was 43 hospitalized cases with, I believe, was it 9 or 11 on vents? I mean, it's a big number, and continues to grow. And the concern is that hospitalizations tend to lag behind the growth in numbers by somewhere between 7 and 14 days. So as long as we're seeing those cases going up, you can expect hospitalizations to go up. Our hospitals currently report that they are in okay shape, but are starting to become concerned about staffing as these numbers continue to grow. The Texas positivity rate, we've talked about before. This is the percentage of tests that come back positive. The governor had indicated that 10% was the red line for him. We are now right about 14%, a little bit below 14%. And fortunately, that number has leveled off and may be declining a little bit in Texas. We'll hope so. But in McLennan County, we are now over 20%. And that is just a staggering number for positivity rate for our county. Remember that, less than a month ago, we were down below 1%. So of all the tests that are being given now, where they were coming in between 0.5% and 1% positive, now we're over 20% positive. So that is an indication of high prevalence of the virus in our community. This is, again, going back and looking at where we've been 2 weeks ago with active cases. We were at about 250. As of last Tuesday, we were at a little under 800. As of yesterday, we were a little below 1,800. Today, we are close to 2,000. These are active cases. These are people that are sick in our community, have to be treated by, they're not all under treatment, but they are all infectious, and it is putting a strain on our healthcare system, and also subjects many more people to the opportunity to fall ill to this. I talked about our active cases by county per 10,000 population. This is of the 20 counties in the state that have over 200,000 in population. On June 15th, less than a month ago, we had the very lowest per capita count of any of these cases, of any of these counties. As of last week, we were in the middle of the pack. As of yesterday, we're fifth from worst. And you can see the counties that are ahead of us are Jefferson, where Beaumont is, Galveston, Nueces, where Corpus Christi is, and Hayes, which is the New Braunfels area. All of those have had a lot of cases recently, and a lot of young folks getting infected. I do want to point out one new tool that is on our COVID Waco website. This is a chart that was done by the Texas Medical Association, and it just gives you some context. I know you probably can't read this here, but I want to invite you to go to our COVID Waco website and look at this. It is different activities and the risk that is associated with them of catching the disease. So hopefully my slides are down now. Last Thursday, Governor Abbott issued a new executive order, GA-29, which requires face coverings over the nose and mouth for anyone over 10 years old when inside a commercial entity or other building or space open to the public, or when in an outdoor public space, wherever it is not feasible to maintain 6 feet of social distancing from another person not in the same household. There are some exceptions, including churches and voting locations, but in each of those cases, while not mandated, face coverings are strongly suggested. As you know, we have been under a mask order in Waco for about 2 weeks now. That order was aimed at businesses and required businesses to have a plan in place, which would probably require a mask unless they could maintain 6 feet of distance between people at all times. But in most cases, that's not possible in businesses. So most businesses now are requiring their customers and their employees to wear masks. That's a very good thing. But our only enforcement mechanism there was against the businesses. With this new order by the governor, our order is still in place with regard to businesses. And so we still need the businesses to continue to require those things of their customers and their employees. But now we're in a different situation where the individuals who are not complying are subject to fines, warnings and fines. And that's important because we don't want our businesses to be having to be the police in the situation. We don't want to have to use police at all, but we are continuing to get reports and complaints about people entering businesses, either entering without a mask or entering with a mask and then taking the mask off. So we are going to begin sending police officers into those stores and other areas where we're getting these complaints to see what they find. And hopefully they won't find people not wearing masks. If they do find people not wearing masks, they're going to talk with those folks and try to understand why they're not wearing a mask and see if we can get better compliance. If they are inappropriately not wearing a mask, they'll be subject to a written warning, and then repeat offenders will be subject to citations. I hope we don't have to get there. We have not had to issue any citations to any of the businesses up to now. And I certainly don't want to have to do that with our individual citizens, but we've got to take this seriously. This is to protect the others around you, And so you're not being brave by walking in without a mask. You're being a problem and a risk to your fellow shoppers and others around you. And I also want to mention that this order from the governor applies to outdoor spaces too, where you can't maintain 6 feet of physical distance between you and others. So like in Cameron Park, there are places where if you are hiking on trails, you can't maintain 6 feet of distance when people are coming past you. And so when I'm hiking, I usually wear a buff, a fishing buff or neck gaiter around my neck, so that if I come into close proximity with anyone, I can pull that up and cover my face before I pass those people. I ask that you all do the same thing. Either do that or wear your mask around your neck, keep it in your pocket so that you can put it on when you encounter folks. It is uncomfortable to wear that all the time when you are walking or jogging or hiking, but it's not that uncomfortable to have something around your neck or have something available to you. Again, enforcement is our last option, but we will do that in a situation where we've got the kind of case count and rising numbers that we are experiencing here in Waco right now. The last thing I want to mention is, as has been said, we've had 14 deaths now in McLennan County. 8 of those have been in the past week. I need you to think about each of these deaths and the mourning that is causing for each of the families that have lost loved ones. We have one family in Waco, in McLennan County, that has lost 3 members of the same family to COVID-19. It's just tragic. And the tragedy, in addition to the human loss, is that so much of this is preventable if we'll just follow the instructions that we've been given. So I will stop there and ask Larry to get some questions going.
Mayor, you'll see that I've got my mask on now, and I normally wear it all throughout City Hall, but because we are only 3 people here in the 3rd floor conference room and we were greater than 6 feet apart, I thought I'd take it off. But you know what? I heard your message, and I'm not going to send out a bad message at all. I want to cooperate in every way I can, as I've been doing in the past as well. So anyway, let's start with some questions. Are any other areas of our medical infrastructure seeing increases due to post-COVID recovery, such as physical rehab or dialysis, and what are the long-term consequences?
I'll give this a shot. I've not heard of any stress on ancillary services at either the hospital. I don't believe that we have seen any of those stress on any of those systems. Certainly, if numbers continue to grow, those areas will be impacted. But right now, I'm not aware of any stress on those systems. With regard to the long-term consequences, among those who have symptoms of COVID-19, as many as 20% will require hospitalization, and probably around 5% of those who are symptomatic will require ICU level care. And of those who require ICU level care, the mortality rate is up to around 1/3 of those needing intubation and ICU level care. So those who have been in the ICU and had particularly all the pulmonary complications of COVID-19 may see long-term lung disease. It's yet unknown what the frequency of long-term pulmonary complications of COVID-19 are, but there are some early reports that a certain percentage of those individuals who end up needing ICU level care and mechanical ventilation do have decreased lung function in an enduring way. Of course, again, 6 months into the pandemic, it's a little unclear how many of even those individuals will recover lung function and what percentage of lung function they'll recover. But suffice to say, a lot of unknowns. There is some risk, particularly among those who are seriously ill.
What are the hospital's current contingency plans, and do we have enough ventilators to deal with this exponential spread?
Dr. Griggs, can you speak to that, please?
So both hospitals designated particular areas for COVID-19 patients, and those are ICU level care in those areas. And while those areas have been blocked off and for weeks and weeks remained virtually empty, now they are beginning to have patients they're placing obviously in those COVID-19 wards. And while we are obviously concerned about the trend, right now there is no immediate threat of the hospitals reaching a capacity threshold either on ventilators or in their COVID-19 ward. There is planning for alternative care site, a surge site, if capacity in the hospitals are reached. The Emergency Operations Center will be coordinating a surge site if that is indeed needed. But there are no plans on the horizon, the immediate horizon for activating that.
The Texas Department of State Health Services now handles our contact tracing, according to a press release from last week. What is our contact tracing process now, and has it changed?
Dr. Griggs, could you speak to that also, please?
Yeah, absolutely. So currently the Public Health District is monitoring 39 cases. The Texas Department of State Health Services has taken on the monitoring for 250 cases. And while I can't speak to any nuances about the differences in actual methodology between the state and our local health district, I thought it'd be helpful to share some of the data that our health district has obtained through the monitoring process. And this is data from June 28th to July 4th that helps kind of illuminate some of the patterns of the disease right now. During that period, that window of time, there were 20 household clusters that were identified, and 65% of those 20 household clusters were Latino. One of the household clusters was African American, and the other were white non-Hispanics. Of those household clusters, 13% reported that there were individuals within the household that had been traveling during the contagious period. That's 48 hours before symptom onset up to present. 6% had reported going to church in person during the contagious period. 26% reported having known contact with someone with COVID-19. Interestingly, less than a third of those had reported that they had been practicing social distancing. So again, of those 20 households, less than a third of those individuals that those households had been practicing social distancing. And really only 38% reported using face coverings. So I think it just supports the value of physically distancing and using face coverings.
There's a business that's not making people wear masks. How can I report this?
Well, you need to call our code enforcement office. That number is 750-5970. I'm sure you're not writing that down right now, but it is at the very top of our COVID Waco website. If you have a business that you're concerned about, please give us a call there and we will go and talk with those folks. And I want to reiterate that, it is our belief and the governor's belief that the mask order is a pro-business measure. It is intended to help us be able to keep our businesses open. And so I'm so appreciative of the 99% of our businesses have been extremely compliant and worked with us on this order. I know it's not easy and I know it's a hassle, but it will make a difference based on all the evidence that we can find across the country and across the world.
What about churches? Do they have to follow the mask order?
The governor's mask order specifically exempts churches, but it highly encourages those who are attending church to wear a face covering. And I want to point out that if you look at that chart that I showed earlier from the Texas Medical Association, one of the very highest risk activities was going to a large church service. But you can mitigate that with physical distancing and with wearing a face covering. So we would highly encourage it, but no, it is not required under the governor's order.
Why have you stopped announcing the number of critical patients?
You know, that was a little confusing. We were reporting as critical anyone who was in the ICU with COVID. And we later learned that in many cases, the hospitals had begun putting all of their COVID cases in the ICU to isolate them from other patients. And so we started reporting, instead of those that were in ICU, we started reporting those who are on ventilators, because they are the most critical patients when they have ventilators. So now if we list them as critical, it means they're on a ventilator.
Dr. Griggs, last week you mentioned getting a letter from the lab stating that they're no longer accepting new tests, but would complete the backlog. Then family practice responded by setting up a way to complete testing. Could you update us on this? And is the family practice now completing all the tests for Waco? And how does this affect the accuracy in the total active cases?
Thank you for that question. The Family Health Center is not running tests for the whole Waco McLennan County community. We are continue to run tests on our patients as the other health centers are running tests on their patients. We are continuing to see patients who do not have a primary care provider, and we are open to new patients. But again, for clarification, we are not running tests on the whole community by any means. Our commercial lab stopped processing viral studies performed in Austin after Friday, June 26th. They indicated this was going to be a temporary hold, and on Monday, the 29th, Family Health Center was able to begin to start processing our own antigen tests. So we were able to do our to run those studies in-house in our own laboratory, and similar to the Abbott Now instrument, those tests do once in a while result negative when the person has a positive case. So so as we've said kind of from the beginning, the answer is not exclusively what does the test say, but it's the test result in conjunction with a medical clinician's judgment is what the sort of the ultimate answer about COVID status is. And regarding the backlogged cases from our commercial lab, those have all been now resulted, and results have been submitted to the public health district.
Okay, are there any measures I can take while I'm healthy that might lessen the severity of COVID if I get it? What about zinc or some other herbal remedies?
Dr. Griggs, that sounds like a question for you.
Then this is a question that I think he answered at an earlier press conference, but it's so important that I'd be happy to answer it again. So sleep is critical to the immune system, and about a quarter of Americans get insufficient sleep. And of course, this number is on the rise with digital devices in our hands and habits of watching television in bed. So I would encourage anyone who's really wanting to do everything they can do for their health to develop a good sleep routine. Remember that most adults need 7 to 9 hours of sleep a night. Try to go to bed and get up at the same times. Develop good sleep habits, and if you're looking for more in-depth guidance, the American Sleep Association has good instructions on sleep hygiene. Physical activity is another way to support the immune system. It does not have to be hard exertion, but stay active. by walking outdoors, or as it gets hotter, doing some light exercise indoors to keep your heart rate up for 20 to 30 minutes a day. That's really all that's needed, elevated heart rate for 20 to 30 minutes a day to get the biggest impact on the immune system. And probably the hardest thing is adjusting diet. I simply advise to take small, sustainable steps towards a more plant-based diet. I think that is, in a nutshell, the general trajectory: small, sustainable changes towards a plant-based diet. Nothing fancy or dramatic or trendy. Just steady steps in the right direction. In terms of zinc or other herbal remedies, the science of benefit around those items remains very thin, particularly in COVID-19. Zinc may have some role to play in colds and upper respiratory tract infections. That's sort of uncertain at this point, but there are instances where things that are purchased and taken that are not regulated by the FDA or prescribed by a physician, nurse practitioner, or PA can harm a person, particularly because they can impact other medications that are that an individual is taking, or have a negative impact on a chronic disease. So I would just say, if you're interested in taking something, consult with your physician.
Is anyone immune to the virus, kind of bulletproof, and can you get it twice?
Dr. Griggs?
Out of millions of cases, there are a handful of case reports where patients have had a positive test, then negative tests and resolution of symptoms, and then had a subsequent positive test. So in most of all the cases studied, there was not recurrence of symptoms, but there's one case report where there was apparent recurrence of COVID-19. So I would just say that there's a very low chance that individuals who recover can have COVID-19 soon after their initial recovery. So in these cases, it might be due to reactivation of the virus because there's a poor initial immune response, or it could be because they get a subsequent infection, exposure, and infection. But to be very clear, the overwhelming majority of people who get the infection, recover, and don't have any symptoms of COVID-19, again, I mean, we're talking about an infinitesimal number of individuals who perhaps have had a recurrence of COVID-19. Saying that, there was a recent JAMA article that explained that antibody presence, it does not necessarily mean that a person is immune. And so again, to kind of consider common antibody testing with some degree of skepticism about whether that conveys immunity. Similarly, in Nature Medicine, there was a description that antibodies can fade rapidly in as soon as 2 months in persons who both have symptoms and don't have symptoms, who have recovered from coronavirus infection. So the honest opinion is we don't know how long immunity lasts. And the intuitive next question that I would anticipate would be, well, then will a vaccine work? And this is just based on what I'm seeing and understanding at this point. While there is a lot of promise about an effective vaccine, it looks like there will probably need to be some kind of booster shots that follow that vaccine to ensure the maintenance of immunity against the virus.
So why are we seeing so many younger people now getting the virus?
Dr. Griggs, can you speak to that, please?
It's just a matter of difference in behavior. I think aging adults and those who are health vulnerable aren't going out. They aren't bringing others inside their home. They're avoiding clusters. Young adults may feel relatively safe from the potentially fatal consequences of the virus and are more willing to take chances that could end up leading to COVID exposure and transmission of the disease.
And just to follow on to that just a little bit, I mean, the big concern there is not only some of those younger folks do have bad outcomes, but also that they bring it home to their families. And we've seen in the last couple of days a trend towards a little bit older age groups in these in the positive tests that are coming in. So I hope that's not what we're seeing. I don't think it's enough to say there's a trend yet, but it is certainly a concern.
Even with a higher incident of positive tests in the younger population, are the mortality figures still highly skewed toward the elderly?
Dr. Griggs?
Yes, and thank you, Mayor, for clarifying that point. That the reason that we emphasize that all of us should wear masks and socially distance is because eventually the virus will get into nursing homes and affect those who are aging, even if it's the young who are the ones who are out there getting exposed and passing the virus one to another. It is virtually impossible to absolutely sequester all people who are aging and who have health vulnerabilities. Just think of nursing homes, how the staff of nursing homes, it's a lot of individuals who are doing great work, but do go to the grocery store and do go to the corner store and will be exposed when the prevalence of the virus is high. So the question around mortality and age, there's a close correlation between mortality and age. To kind of review those figures, I'm going to give some kind of approximations so that just to help kind of keep in mind where those strata of age and the risk are. This is based on multiple studies and reports from multiple international populations. So less than 50 years old, less than a 1% chance of dying with COVID-19. In your 50s, about a 1% chance of fatality. And we're talking about case fatality rate. So we're talking about those who know they have the coronavirus. In the 60s, in those who are 60 to 70 years old, around 2 to 3%. In the 70s, somewhere in the 5 to 13% range. The case fatality rate, the mortality of those who have COVID-19 in the 70s, somewhere between 5 and 13%. And 80 years old and older, between 13 and 20% case fatality rate. So those are the age breakdowns, but it's also important to highlight that the mortality rate in those with pre-existing chronic conditions are also higher than the population that does not have chronic disease. Those with chronic illness are 6 times as likely to be hospitalized and 12 times as likely to die from COVID-19 compared with those who don't have chronic disease. And in the study that looked at specifically what are the most at-risk chronic conditions, in kind of descending order here, it's cardiovascular disease, diabetes, and lung disease.
Mayor, I think we'll stop right there and let you open the line for the media that are in attendance and let you call on them and let them ask some questions.
Sounds great, Larry. Thank you. The first reporter I have is Drake Lawson from KWTX. Drake, are you there?
He is. Let me just let him in.
Okay. Give him a minute to join.
He should be joining. He should be on.
Drake, are you here?
Yeah, can you hear me, Mayor?
We can. What's your question?
Okay. Perfect. So the first question that I have is regarding hospital beds in total. I know that we went through the hospitalizations for COVID, but I know that a lot of people are going through procedures right now and whatnot. Do we have the total number of hospital beds that are taken, and how many hospital beds are left?
Dr. Griggs, do you have that information handy?
I don't have the capacity numbers handy right now, Drake. I do think that that the hospitals are going to are right now evaluating the sort of the prioritization of those procedures that could be considered elective procedures, and will probably continue to do so through the course of the of this particular surge in cases. But in terms of actual beds used, et cetera, I would refer you to the COVID Waco website.
Yeah, and I don't think the website actually shows beds in use. It shows total beds available, but it doesn't show beds in use. And we probably need, if we can get that added as a metric. Just so you know, Dr. Griggs and I and Judge Felton, among others, are on a call, a teleconference every Monday, Wednesday, and Friday with the hospital leadership discussing these issues. And we had a call this morning at 11:30. The hospitals at that time, as Dr. Griggs said, they have enough beds right now. They're not concerned about that at this point. This can change, and it can change pretty quickly. But at this point, they feel like they're able to handle the surge, and we are monitoring that every other day to be sure that continues to be the case. Jasmine Caldwell, KCN, are you on?
Can you hear me okay?
Yes.
Now we can hear you. Go ahead.
Okay. My question was really similar to Drake's. And I had saw on the state of Waco, the state's page that the Waco Trauma Service, there was 11 ICU beds available. And I was just wondering, do you think that that's enough considering the rising cases?
Well, that wouldn't be enough if that was all there were, but the beds that are reported are the licensed ICU beds that the hospitals have. During this COVID pandemic, some of the rules that they have as far as their licensure have been relaxed to allow them to stand up other areas that are equipped to handle ICU patients. And so they have the ability to flex much larger than what the numbers that are traditionally shown. And we've tried to talk about that, maybe not every week, but every few weeks about that fact. And it is, they have at least 46 additional beds that they can flex into, and probably more beyond that. Dr. Griggs, would you add anything to that?
No, I think that covers it.
Okay, thank you. Rhiannon Sagert with Waco Trib.
Hello. Can you hear me?
Yes, we can.
Great. There was a recent New York Times article saying that there's growing evidence for this virus being airborne. How much truth is there to that? How do individuals protect themselves? And how will hospitals cope if that's the case?
Dr. Griggs, I'll let you take a stab at that one.
Yeah, it's a great and timely question, Rhiannon. Thanks for asking it. So we have known from the beginning that this respiratory virus acts much like other respiratory viruses in that it is transmitted via droplets. Those who study transmission and droplet dynamics, they have categorizations of how small does the droplet need to be before it is aerosolized, and it's measured in micrometers. And it's when it becomes so infinitesimal that it can kind of hang and linger in a room for an enduring period of time, it's described as an aerosolized virus. The World Health Organization has been very clear that the virus is principally passed through larger respiratory droplets, those that get sprayed from person who's speaking or sneezing or coughing to another person within that 6 feet distance, which is why we've been from the beginning saying stay at least 6 feet away from non-household members. Large droplets that carry the virus. Recently, there was a group of, I think, 237 or so scientists from multiple countries who published an open letter to the World Health Organization saying, hey, there is enough evidence now that this virus can be aerosolized that you need to modify your language and your recommendations according to this new science that's been coming forth. I think I think it's important to know, though, that there are also retrospective, so backwards-looking studies of groups of people who have been exposed, and when they have been traced out, have not seen exposure in that kind of big environment. So looking at positive cases, looking backwards and saying, where did you get exposed? Again, the majority of those cases we think are still through large droplets. So what that tells us is while some of the science says, yeah, this virus can be aerosolized, but looking at positive cases, the vast majority of them are through big droplet spread. The conclusion is that yes, there is risk in closed spaces with non-household members, particularly when there's poor ventilation, even if you're 6 feet apart. So aerosolization probably does occur, and transmission through aerosolized droplets probably does occur, and it occurs in enclosed spaces that are densely populated, even when there's 6 feet distance. So while it's still not by any means the majority of cases, the way to avoid transmission via aerosolized exposure is through keeping doors and windows open, preventing, particularly in enclosed spaces, preventing density of the population in enclosed spaces. So keep if it's a small restaurant that's all enclosed with poor ventilation, then it needs to be sparsely populated as opposed to densely populated. I think that gets to I think that's the best science that I know right now.
Thank you, Dr. Griggs. Drake at KWTX, do you have another question?
Can you hear me?
Drake, are you there?
Can you hear me?
We can barely hear you.
Real quiet.
Try to talk a little bit louder. So the last question that I had for you was, we're having a lot of people trying to figure out what citation will be given to them if they don't follow the mask order or they're repeat offenders. Will it be a disorderly conduct? What kind of citation will be given to them?
That's a great question, Drake, and I don't think I have the answer. I believe it is a misdemeanor offense, and it would be a violation of the governor's order. But we'll see if we can get the answer to that for you and get that information to you. Again, that is the last thing that we're trying to do is issue citations. That is not a good use of our police force's time. We just need people to comply with the order. Jasmine at KCEN.
All of my questions were answered, so that was the only question I had previously.
Okay, thank you for joining us today. Rhiannon, do you have any follow-up?
Yes, about the Sanderson Farm testing. Is that testing complete, and are there plans to test at any other meatpacking facilities here locally?
My understanding is that testing is complete. Is that your understanding, Dr. Griggs?
Actually, I'm a little out of the loop on that.
Okay, well, they did a complete testing of the Sanderson Farms employees and got like 95% of them tested. There were a few that were on vacation or I think a few that would refuse to take tests and had to be sent home and quarantined for 14 days as a result. But my understanding is that all of that testing is completed, and we don't have any plans for any future testing of meat plants, but that could occur if we have another outbreak. If that, that's all based on the testing of folks that work at those places, and if they start showing cases, then we could do that again, just like we have very recently for the jail. So I think we'll stop with questions there, and I'll ask Dr. Griggs if he has any closing comments.
I think I used all my words in my time at the beginning, so I'll keep it very short and just continue the plea to when people have strong differing opinions, just to recognize that this is a time of great stress, and that not all of the conclusions that individuals are making are due to let me say it differently. Some of the conclusions that people are reaching may be due to some more deep-seated feelings and emotions, rather than just being fully informed and coming to a conclusion that's based on good science or logic. In that same vein, I would just again reiterate: please be very, very cautious with social media and the information that's coming through social media channels. Remember that there's an echo chamber, that people tend to move in the direction of their previous biases or their previous affiliations, because it feels better to hear information that reinforces your current paradigm, as opposed to information that comes in conflict with your current paradigm. So in an era when anyone can get a national audience via social media, and information is being spread through all varieties of channels, be very cautious about where you're consuming information, and be aware that there's an echo chamber, and the risk of the echo chamber, which is that you're just going to reinforce the predispositions you already have, as opposed to listening to multiple vantage points and sorting through what's really true.
Well, thank you, Dr. Griggs. I really appreciate you coming on every week. As much as I think about and read about COVID-19 and the risks and the effects, I always learn something new from you at each one of these press conferences. So thank you for that. Larry and Esmeralda and Kelly, thank you all for being here. We appreciate the work of our Public Information Office, our City Secretary's Office, and the Health District, knowing that the Health District is under unbelievable stress right now with the number of cases. I want to remind you, if you have not filled out your census, to go to census.gov and fill it out. It takes less than 10 minutes. If you have filled yours out, please talk to your friends about filling out the census. This is so important for funding for our local projects, and also for representation. We've talked about this over and over again, but we still don't have the kind of response rate that we need. And so I feel like I need to remind folks of that. I want to ask for your prayers for each of the victims of COVID-19 and for their families. The fact that we've had so many deaths here recently is just, it's really hard for us to believe and hard for us to take. And the family certainly needs your prayers. And again, ask for your prayers for our frontline healthcare workers. They are under greater strain right now than they have been during this entire pandemic. And I know there are those who think COVID-19 is not a real problem. I would ask you to talk to a frontline health worker that you know and trust. You probably know more than one. Ask them what they're experiencing. I do need to remind you that we are going to have police officers out looking for violators at this point. We are not, we certainly do not want to issue citations, but we need to get compliance with this order, again, to keep our businesses open and to keep our public safe. So please take care of one another and take care of yourself. Thank you.
I want to thank both of you all again for always giving so much time and valuable information. There's more information available. Also, I'd like to tell you about a virtual town hall meeting that will be happening this Thursday. It'll be carried live on our channel here. And just additional information, it's It's titled Virtual Town Hall, The Impact of COVID-19 on the African American Community. It'll be Thursday, July the 9th, starting at 6 o'clock on our channel. You've heard all the information. It's pretty easy to do. Wear a face mask, social distance, and abide by the rules, and we'll get through this thing. Thank you all for joining us. Have a good afternoon.